Scenes like these from China's cities in lockdown, becoming now familiar across the globe following new deaths caused by the novel coronavirus. Asia remains the continent hardest hit by the outbreak. On Sunday, South Korea raised its disease alert level to the highest possible. There are hundreds of registered cases in the country, and the number of new infections is still surging.
I'm concerned, as there are a lot of people infected now. But I think there would not be so many infections if people took better care of their individual hygiene, kept themselves updated with the news or official announcements, and stayed away from crowded places.
Meanwhile, the COVID-19, commonly known as the coronavirus, is becoming increasingly political. In Iran, Supreme Leader Ayatollah Ali Khamenei accused Iran's enemies of spreading propaganda about the virus online in order to stifle voting in Saturday's parliamentary election.
You know how massively they worked, using various platforms to lower voter turnout. The last pretext they resorted to was this coronavirus, which has scared many.
However, Iranians accuse their leadership of hiding the real scope of the outbreak.
We don't know what's true and what's false, since the government is constantly lying to us.
Health experts say maintaining a healthy immune system is key to fighting off the virus. Protective masks are now the dominant picture of residents on alert. In the Philippines, this wedding reception even required attendees to wear facial protection. As the global coronavirus outbreak still needs to be contained, taking care of one's personal hygiene has for some become the ultimate expression of love.
Authorities in Italy have imposed a travel ban on about a dozen towns in the north of the country, an effort to prevent the spread of the coronavirus. 2 people in Italy infected with the virus have died, and officials there are reporting about another 80 confirmed cases. Some 50,000 people are affected by the lockdown, which is near the city of Milan. The small town of Codogno is at the epicentre of the outbreak there.
The streets of Codogno were empty on Saturday evening. People in a dozen towns in northern Italy were told to stay indoors after a local woman died, presumably from the coronavirus.
We still can't say whether she died of the coronavirus.
Professor Stemmer, thanks for joining me. It seems that the source of the outbreak in Italy is still unclear. Why is that?
Yeah, the possible person, contact person, has been in China, of course. But this person has been tested negative for the virus, and the person claimed that he had no symptoms at all. So this makes it more unlikely that this is a contact person. However, there's one possible explanation. It depends on when the meeting between these 2 persons was maybe some days ago, and maybe at this time the person still was positive for the virus and recovered in the meantime. And that it's the only explanation I have up to now to explain this cluster.
Right. And Italian authorities are taking some serious precautionary measures to try and to contain this outbreak. Are they making the right decision there?
They do the best they can. They try to avoid person-to-person contact as much as possible, and they try to avoid people traveling into this region and traveling outside this region. So they do the best they can, actually.
And Chinese authorities are reporting that the incubation period, which was originally thought to be 2 weeks, could actually be a lot longer. How likely is that?
It's a single case. It was a 70-year-old man, and he had 27 days no symptoms, but a positive virus test. So although it's a single case, it shows us that it might be even more complicated to get the virus under control. Yeah.
One of the latest countries to be affected by the outbreak is Iran, with 28 confirmed cases at the moment and 6 deaths. How serious is the situation there?
Yeah, I think it's serious because if you calculate the numbers of deaths compared to the numbers of infected people they report, for me it seems that we have more people infected without knowing that actually. So it's serious there, yeah.
With the exception of Egypt, Africa hasn't been yet affected by the outbreak, but the World Health Organization has warned that African health systems aren't well equipped enough to cope with a potential outbreak. What needs to be done there?
Yeah, it's the best way is to spend as much efforts and as much money as we can to prepare them for having the virus in their countries. However, I'm not sure whether it's possible. We hopefully the virus will not come to Africa.
Martin Stürmer reporting for us from Frankfurt. Thank you.